that journey really solidified his interest, and it became a conviction that allowed him to strategize his entire application so clearly. So we took him through, I think, a very reflective journey whereby, we talk about all these interests, passions, values, beliefs, purpose, meaning, all those deep questions, right? Which I think he has a lot of time to think about, to explore, to kind of sound it off us as well. And then I think slowly, right, he found that, hey, medicine is where he would like to go into, because it became very clear to him that he wants to be a doctor in this process. Medicine, let's face it, it's a 10% selectivity. So there's really not much room for error. You have to make sure that the entire application is holistic, is tight, is as strong as it can possibly be. So there's obviously a lot of work that, we kind of coached him into taking up. So one is, he got himself involved in clinical attachments. So both at a hospital and at a GP. So that was that gave him, I think, a breadth of what a doctor could possibly be involved in, whether it is at a whether it's patient care, patient communication, or at a bigger hospital setting, right, whereby you could be doing rounds in the wards, whereby you're working with different kind of teams to arrive at treatment plans or diagnosis. So the settings are very different, the skills are different, and he got to see all of that, which is very helpful. Obviously, if he gets into medicine, then he would do all that general study and then specialize later on. But I think it's also important for him to understand what potentially would interest him more, because he will be able to discuss that in a lot more depth, right, when he were to meet with his interviewers, for example. So it's important to kind of take your interest further as well. It's not enough to just say I'm interested, but show me why you're interested. Show me what you have, the kind of research and the length that you went into to find out more about medicine. So he did, do his research, he read into some papers, and he was able to, I think, talk very convincingly in his personal statement, right, when addressing the question, why do you want to be a doctor? Once you have this clarity, then naturally everything else will fall into place.